For nearly 50 years, Biotics Research has been a trusted leader in the nutritional supplement industry. Known for uncompromising quality and innovative delivery systems, the company continues to advance the field through ongoing research, unique formulations, and rigorous quality control. Family-owned with a rich history, Biotics Research is most proud of the strong partnerships it has built with the healthcare professionals. On Adjusted Reality, we talk about living strong, vibrant, and healthy. And that starts with the environment around us, whether it's practice or at home. Force of Nature Pro makes it easy to protect your whole being and those you serve with an EPA-registered hospital-grade disinfectant that's powerful against germs, yet free from harsh toxic chemicals. It's safe on hands, treatment tables, and everyday surfaces while supporting better indoor air quality. Plus, it reduces single-use plastics and costs up to 80% less than many traditional products. If you're ready to align your life, your practice, your family routine with a cleaner, more sustainable future, go to forceofnatureclean.com for home and forceofnaturepro.com for exclusive business pricing and limited time offers. Healthy space, healthy practice, healthy life with Force of Nature Pro. Welcome to Adjusted Reality, a podcast series trusted by the adjusted and brought to you by the Foundation for Chiropractic Progress, where we learn from athletes, celebrities, influencers, and healthcare professionals about how to optimize health in a fun, relatable way. Join me, Dr. Sherry McAllister, as we welcome spine and brain surgeon, Dr. Anthony Conte. Dr. Conte is a highly skilled spine and brain surgeon dedicated to helping patients restore movement, reduce pain, and improve quality of life. Currently practicing in central New Jersey with the New Jersey neurosurgeons, is trained at top medical institutions. He brings advanced expertise in minimally invasive spine surgery. He focuses on treatments that preserve natural motion and help prevent future spine problems. Beyond complex conditions, Dr. Conte also specializes in complex cases, including scoliosis, spinal tumors, and revision surgeries, as well as brain conditions like tumors and hemorrhages. His compassionate, patient-centered approach makes his advanced care more accessible and effective, and it is exactly why we wanted him on Adjusted Reality today. Welcome, Dr. Conte.
Thanks for having me, Sharon.
It is an exciting moment in many people's eyes to know that prevention is a key, but you're also on the reactive side. You have to respond quickly, you have to be capable, and you're basically creating an environment where the patient can really then go from I'm in harm's way to now I have an opportunity to heal and regain my life back. That's an impressive place to be. But what I want to start with today is just kind of going backwards in times, because I always find it interesting when we talk to someone of your skill set and your expertise. What brought you into this to start with, and then why spine and why brain surgery?
That's a great question. I've always been interested in the nervous system, and even from my early days in med school, saw the profound effect that these major life-changing operations that really very few people, even in the medical field, wanted to even approach or perform, just given the high stress and nature of them that is so intense. But from the first time I saw a brain operation, I was hooked with the complexity, the skill that was involved in performing it, and just the recovery that the patient had afterwards that profoundly changed their life. So that was something that initially attracted me to neurosurgery to begin with. And I think that as I dove deeper into that profession, I saw that And something that a lot of people don't really understand is that neurosurgeons actually, the majority of the operations they perform, even greater than 80-90%, are actually spine operations. And as neurosurgeons, as in the kind of layman's community, we think that, oh, it's a neurosurgeon is just a brain surgeon. They just operate on the brain and that's it. But what I was even introduced to as well too is that no, they are actually pioneering the field of spine care and spine surgery. And day in, day out, as I became more acclimated to the life of a neurosurgeon, I saw just how many spine operations one performs and the amazing life-changing effects that it can have on their patients.
You're right. You came into a field where it really does alter your activities of daily living. Like there is so much to be said for the quality of care that you give and the expertise when you need spinal surgery. And I want to kind of bring you back. The very first time, do you recall the very first brain surgery that you walked into? And if so, share with me your thoughts, because I know you get anatomy lab, but there's nothing that I think prepares you for the real live moment where you walk in. It's all the senses at once coming to you. And this is just your first experience of watching someone else do it. And then translate that to the very first time you're doing it. What was that moment like? Because I think as we sit here today, a lot of us patients of potential surgeons, and some of us hoping to never see a Dr. Conte. But please know that is in a loving way. What was that like, going from the first you saw it and then going from the first moment that you actually had to do a brain surgery?
Sure. So the first brain surgery that I actually witnessed was a craniotomy for what's called a clipping of a ruptured aneurysm. So the patient came in and had a ruptured brain aneurysm and was pretty somnolent, but still able to converse. And I got to see from the very moment that the surgeon talked to them about the situation that was happening and about the surgery that was needed, followed by going into the operating room, witnessing the surgery actually perform a craniotomy. And I think that the most striking moment for me was the moment that we performed the craniotomy, the bone is taken off, and the dura, which is the lining of the brain, is opened in order to view the brain itself and approach the aneurysm. And I think the moment that dura is opened up and you can see the brain is really a life-altering moment where for the first time you actually see the brain exposed face-to-face. And it is just visually striking and something that is can't really describe into words the first time you see that. And I watched as my mouth was open wide and I couldn't believe it, but this surgeon essentially kept calm, kept cool, collective, and under a microscope, it feels like he has feet of room to operate in. But really, when you look at the surgical field, he's operating in a corridor of millimeters and having to dissect down to an aneurysm that is oftentimes at the base of the brain through very vital structures of the brain in order to place a very small clip on an aneurysm that might not be more than a few millimeters big. And it's a very high risk operation where one false move can lead to a re-rupture of that aneurysm and potentially fatal complications. But he was able to successfully do it, and I got to follow that patient's clinical course in the hospital, and they made an excellent recovery within days to the point like nothing happened. So, and that was really the first time I saw an operation of that magnitude. Saw that people think that neurosurgery is this field where we deal with devastating conditions where patients don't do very well, and it's actually the complete opposite. Patients can have life-altering improvements in their condition from these very, very dangerous pathologies. And that was really my first introduction into brain surgery. And then from there, I progressed my training and I entered into a neurosurgery residency. And I remember my first case was doing a life-saving operation, doing a hemicraniectomy, where in a trauma, you have to remove an entire side of the skull in order to evacuate blood and to basically allow the brain to swell out to save that person's life. And it was a young male involved in a car accident who had a large subdural hematoma, a large collection of blood pressing down on their brain. And again, it was I went in, and with the help of my more senior residents and attendings, I was able to make burr holes and lift off that side of the skull and evacuate the blood, and perform a life-saving operation where that patient had an excellent recovery, and ultimately down the line was able to have that bone placed back on his head and able to live essentially a normal life. And I got to see that I've been slowly progressing to the point of watching these surgeons perform these life-saving operations, to be able to do that myself and be able to give my patients the ability to have these excellent outcomes.
It is a moment for many of us who've never heard a neurosurgeon even share a story like that. I think that's an adjusted reality. It's a moment of reflection that you're human, and there's definitely, when it comes to the sight, the smell, the people, the environment, all of the things that go into going into a surgery of this magnitude. Because let's be honest, aside from a cardiologist, the brain is the number one most important organ we have. And aside from a cardiologist, you're the number one person who can keep that individual alive at that point. There is no other options, and sometimes it has to be walking into an emergency room operation where you know that this surgery is absolutely necessary for life, and that you're the person that they're depending on. There must be an overwhelming sense at some point. How do you deal with that? Because you noted very succinctly that when you first watched the first surgery, they were very calm. And not everybody's born with a calmness about them. I would probably hesitate to guess that it's also a very learned opportunity to be controlled and steady, knowing that you're dealing with millimeters and looking through a microscope. Share with me a little bit on that end.
Yeah, absolutely. It absolutely doesn't happen overnight. It's something that takes years and years of training to gain that confidence, gain that calm in order to be the calming presence in a room where many are unsure of the next step to do and are really unsure of where to go. And it's really something that my mentors have really trained me to be that calming presence, basically. Even though, like a duck whose legs are paddling underwater, internally you have a million things running through your brains. What are next steps? Would a patient have a better outcome of this? Is this something where I think it's not something that is really a recoverable injury, and it's something that you have to take every patient, every pathology into account, and you have to be that calming presence in a hospital filled with other physicians in order to make the right choice, in order to make the right move in the surgery, in order to do what's best for the patient. So ultimately, we deal in some of the most high-stakes surgeries and high-stakes pathologies, and absolutely not everyone does have a great outcome from these very devastating injuries or devastating brain or spine pathologies, but it's something that you do years of training, hours and hours and thousands of hours of training in order to have the best skills necessary in order to go into each situation as prepared as possible. So, even though the exterior tries to remain calm, sure, interior, you're thinking of a million different things, but ultimately trying to do what's best for each individual patient.
I kind of look at it almost like, this will sound funny, but really it's like being an Olympic athlete. because it's the training involved to get you to that special place. And your Olympic event really is almost every day when you do a surgery. It is, I have to be the best, get the gold medal, which is keep the patient at their level of healing that is going to maximize their performance. And there's nothing like the real thing. And I'm sure when you did your first surgery, you thought, okay, practice was great, but this is like the real deal. Like I'm in this now, and I have to make sure that I keep calm and keep my team strong. Because that's another thing I think often overlooked is where you sit as a neurosurgeon, you also have a team. How many people in your team typically come into the OR?
I, it's it's quite a lot. I mean, you have the attending physician, but he is supported by a number of different staff, including either his resident or physician assistants that are assisting him. You have a tremendous amount of OR staff, including nurses, scrub techs, who are supporting you as well too. You have imaging technologists as well too, who are helping with the microscope, helping with X-rays. Technicians that are performing what's called neuromonitoring, which is monitoring patients' neurologic function during the case. So behind every neurosurgeon and every physician, there is a literal army of people that is also coming into play to assist them and make each and every case possible.
You probably don't get this question very often because most patients don't ask who's going to be in the operating room. But let me ask you this. In the many years that you've been doing neurosurgery, how much of an impact from 0 to 100 does the actual team make to you? 100 being like, I absolutely need them in the room, to 0 being, could care less if anybody was in the room, I got this.
100%, 100. Yeah, I mean, it is something that you rely on each and every member of your team. It's a chain that if one link is not there or supporting the rest, things can go downhill very quickly. And you know that, you see that in emergent situations where you might not have all the resources available when an emergency comes in and you're operating at 3 a.m. in the morning and don't have everyone there that typically you would have. You see the difference and you notice the difference. So it's really, it's not a me thing. It's a team effort with every surgery that we do.
I think it's beautiful the way you surrounded that question. Is it is important, and you see the value that each person has, because oftentimes you think when the neurosurgeon walks in, he's the it guy and everything revolves around him. And if you're a patient, obviously you never get to see how many people are in the room. But reflecting on seeing several surgeries now, I was amazed that you could even breathe in there with how many people are in the room.
Yes.
And I think the other beautiful part was everybody that was in the surgeries that I've seen were like best friends. They were, you could, if it was a tango, they knew exactly what move it was going to happen. If the surgeon moved his arm left, the team was moving right to give him the opportunity to be as successful as possible. And I thought it's really important that our listeners also hear that you depend on an army of very highly qualified individuals doing a very specific job, and that you also reflect, when you have to go in there at 3 a.m. and you don't have that whole team, that's not the Olympic trials. That's the Olympics. And you're now, slightly disabled with all of the things you got to do, but you got to do what you got to do.
Exactly.
Yeah. Oftentimes you said you work on the spine. And I'm glad that you said that, because I often get questions when I refer it out to a neurosurgeon. They're like, there's nothing wrong with my brain. And then I would say, that's not what he's going to be working on. We're going to talk about surgery, because you have passed the point of conservative care. And I think this is a really important piece of it, is understanding the when surgery is necessary. And you have to cross that threshold a lot. And I'm sure there's times where this is really awkward, because sometimes you're kind of like, I'm really hopeful I don't want to do surgery. Reflecting on surgery is an important piece, but if we can manage to do something different, we will. Can you share with me some of the reflections you've had over the years where it was difficult to make that final call? What was it for you to say, more on a general level, like, I know the right thing to do is now, and obviously the patient has to weigh in on the value of surgery as well. What are some of the things that you've learned over the years in calling it's time for surgery?
Well, what I've seen is, and in my practice, the majority of patients that see me, you know, I don't recommend surgery and may very well never require an operation. And that is really the goal. I tell each and every one of my patients that I am the last, I am the last line of defense. Basically, I'm the last person that you want to see. And I tell my patients, listen, I completely understand. I'm the last person that you want to see right now, but you are seeing me for a reason. And every single patient that I see that that presents with symptoms such as pain, I try to manage with conservative care and physical therapy and chiropractic care and pain management. I think it's those patients that come in really with worsening neurologic symptoms, worsening numbness, weakness, sometimes really advanced symptoms such as partial paralysis or bowel and bladder changes, where you need to have those difficult discussions with them that these are rapidly progressive symptoms that even with surgery might not have complete improvement, but I really urge you to undergo surgical intervention because these progressive decline needs to be halted as quickly as possible to try to restore some function. And I think that a lot of my patients come in all age ranges, and it's difficult for, I've seen a lot of people that have had multiple spine surgeries and are accepting that, maybe another surgery would be needed. I also see young patients who are very resistant to the idea of surgery, and that's always a difficult discussion is we try to get them along with conservative treatments, but there are some that absolutely need surgery, and having to have that conversation with them that, this is a life-altering decision that unfortunately I am recommending for you, but I think will maximize your quality of life is always a difficult discussion. And it's something that I don't take lightly, and I never take any conversation lightly with any patient when it comes to surgery. But that is, in particular, one of the most difficult situations to have.
We share something very similar, and that is oftentimes that word last resort. And from a chiropractic perspective, we end up being the last resort many times. Like, I've tried everything and nothing works, and now I'm here with you. And then we kind of smile and we think, this is very unfortunate because we are your last resort. That's how I became a chiropractor. I was everywhere and nothing worked. And I will tell you with 100% certainty that I was giving up. I was just not in a place where I could really bear the reality that I was going to live like this. And having seen the chiropractor as my last resort, and here I am today, I get that oftentimes we are the last person that they want to see. And I think for chiropractic, though, we should be the first person that they should see. And that if we put this in a paradigm shift, and it's a pyramid, you're at the top of the pyramid, but for the right reason, which is you are the life-saving alteration that's going to make the biggest difference when necessary, and important that the patient understands why that is such a critical component and why conservative care is no longer the answer. And I think you do such a great job of that. And I remember being at Chirothon with you and really thinking through, wow, I have had many conversations with surgeons that it's not always been I'm the last resort. It has been, well, we should try surgery and I think those years are now gone. I think now we're starting to reflect that the time, the place, the manner, and especially now because your techniques are so beautiful, like minimally invasive surgery. Share a little bit about when you first started to where we are now with the technology.
Yeah, so technology has exponentially grown even over the last 10 to 20 years in terms of the surgical techniques and technologies that we use for the spine. Um, in the 80s and 90s, they were mostly very large, open fusion surgeries. We're making a very large incision, stripping away the paraspinal muscles that surround the spine, and placing hooks or pedicle screws to stabilize the spine. And the technology just wasn't necessarily there, or it hasn't. And I think we've kind of caught up and learned from our mistakes of those previous decades, and really now I think something that's tremendously altered the trajectory of spine surgery has been the advent of using navigation, which is essentially using intraoperative imaging like a CT scan that we get immediately prior to the surgery, and pairing that with a navigation system in order to place hardware, place cages, know where we are in the anatomy within a millimeter accuracy. And that allows me to not even look at the total picture of the spine, making these large incisions to look at the entire spine. It allows me to make extremely small incisions and place hardware percutaneously using this navigation in order to really preserve muscle attachments, minimize muscle disruption, improve post-operative recovery, and get patients back on their feet quicker. So what we're seeing is patients were in the hospital for north of a week or two, and now we're able to do these fusion surgeries where they're out of the hospital really within 24 hours, and it's been and reduced their complication risks by tenfold. It's been an amazing 10 to 20 years of this explosion in technology and spine technology where we've really been able to improve people's outcomes. So I think that there's been a lot of hesitancy around spine surgery from patients because they've had a relative who's had spine surgery a number of years ago and it didn't go as planned or was an extensive recovery. But I think that there's a disconnect between patients' understanding of what spine surgery is today versus where it was even 10 years back.
Very well said, Dr. Conte, because I'll tell you what, the difference between, in chiropractic as well, the difference between techniques that we did 15 years ago are so much more precise and really diagnostically we've done a lot to improve our techniques. For you, though, you also have another piece that we don't have to deal with, which is the equipment and also what goes into the body. And I'm sure that has changed quite remarkably as well.
Absolutely. I think that, now we're doing, whereas we would do these big decompression surgeries through an incision half a foot long, now I'm making an incision the size of a quarter and able to dilate a tube down onto the exact area where there is nerve root compression and decompress a nerve that can provide the same degree of relief with recovery that is only within hours. So I think that the instrumentation that we use within the surgery has only continued to improve and continue to improve. I can talk even upon motion sparing techniques, which are not just fusion surgeries, but also doing disc replacement surgeries, where instead of fusing an area, we're able to place these new implants that preserve motion and potentially limit the need for further surgery, which has really taken off, especially in the neck and the cervical spine.
Wow. That's actually really impressive because even in my time of watching my patients have had surgery and then them coming back, and that was also one of the things I had to educate the neurosurgeon on that I had spoken with is they're often fearful for the patient to return because they know what they did internally and they want the chiropractor to know when the patient returns to you, here's what I did. Right. That's a very, very important conversation to have intercollaboratively to say, here's what I'm going to do as a doctor of chiropractic and here's what has been done through your neurosurgeon. And we have had these conversations about what you can and cannot do. And motion was always one of those pieces where we had discussion. So I have 30% limited range of motion in lateral flexion and rotation, and the doctor doesn't want us to do X, Y, and Z. When it comes out of the patient's mouth, you're still thinking, do they even understand? But and that's why I love having this conversation, because we're educating the consumer right now that a team approach is really an effective approach. Conservative care is critical, and in no sense is ever wasted, but it can be obviously one of those timing issues that, reflective going back, this is a surgical candidate, they need the care now, and then restoration and rehabilitation can take place more effectively. Those are conversations that I think the doctors need to have together, so the patient comes out with the best understanding of what the future is going to look like. And I think you do such a great job of that. The other piece is technique. And this was one of the things that a lot of consumers don't know. There are many techniques that happen both in the chiropractic world and in the neurosurgery world. And some doctors are not, and I remember this with my son when he had his appendix out. We had an option. He said the minimally invasive surgeon is not available until 6 a.m. for your appendicitis, for the appendectomy. And I said, okay. Now the other surgeon, well, he does a different technique, and it's a larger incision, longer recovery time. And I know your son is an athlete, so there's time to think through. Obviously it wasn't a life-threatening moment of what that means, but it also made me aware that surgeons have different techniques. And if you were to tell someone, because patients come in with an understanding that this is a neurosurgeon and they're going to do it, what would be some of the things that if a patient had to have, let's say they're having severe low back pain, L5, that's the lowest vertebrae in their back, before it hits the what's called the sacrum. What are some of the questions that a patient, in your response, if you had a family member that was going to have surgery across the country and they needed to have an L5 disc operated on, what would be some of the things that you would say to your family member? Make sure this neurosurgeon potentially is doing X, Y, or Z. Would you guide them in that and picking the right choice neurosurgeon?
Yeah, absolutely. I think technique and whether it's done minimally invasively does have, tremendous benefits. So I think that's, one of the first and foremost questions to ask for your surgeon is do you perform minimally invasive techniques? Are you able to, take care of this pathology through a minimally invasive approach? Or are you classically more of an open trained surgeon where it typically requires bigger incisions? And I think that, at least for my family members, number one, first and foremost question I would have them ask was, what can I do, conservatively to treat this in order to, get this pain better under control or feeling better? And if surgery is needed, what is your preferred surgical approach to it? I think that's the first and foremost questions I would ask a surgeon if I was coming in something like an L5 radiculopathy or L5 related nerve pain with everything. And I think that's really the questions that, because I think that a lot of patients have a misconception that every single surgeon is trained the exact same way and everyone does the exact same operation the same, which is not the case.
I'm glad you said that, because it's often I get hit with, well, I'm not going back to chiropractic because the last chiropractor did something I didn't like. And I was like, wait a minute. First off, why are you back? Why are you in my office? Yeah. And second, you do realize there's different techniques, right? And so I think Dr. Conte just opened a lot of people's minds in knowing that there is variation, and just like any other profession, there are opportunities for greater success based on the techniques and the training of that individual. So thank you for pointing that out. And because you have seen so many patients over the course of your time, what in your mind are some of the common habits that you see that really are hurting people's backs that perhaps they can avoid the questions altogether and they can protect themselves being proactive in their approach?
Really, a lot of patients that come to see me, the number one problem that is leading to their back pain is poor spine ergonomics or low core strength. I think that I see a lot of patients in my clinic that have either injured their back from lifting a heavy object with their back, walking their 90-pound dog that then pulls on the leash a little bit too hard and yanks their back. Or you have patients that you can see through the imaging that they have a kind of low core strength. They don't have properly developed paraspinal muscles or core muscles. And those core muscles we rely on to stabilize our spine, to limit degeneration over time, to essentially take the load off of our spine, to limit pain. And when you have low core strength and more central mass or obesity, or it all combines to place more and more stress and instability on the spine, which ultimately causes back pain. So I think if there's a common theme in a lot of patients that come see me for back pain issues, it is patients that perform poor spine ergonomics. They're often hunched over or pick up objects with just utilizing their back and create a lot of muscle strain, or it's patients that don't protect their core and don't engage their core enough on a day-to-day basis to prevent these spine problems from happening in the future.
Well said. It's a lot to share with people how important core exercises are. I'm imagining you and I are in a similar boat as, you can only say so much. It's kind of like the dentist. You've got a cavity. Okay, here's where we are. It was preventable.
Mhm.
And here's what you need to do. It's called flossing. But going back to the core, um, do you have favorite exercises or stretches that you actually give patients that you think are highly effective?
Yeah, I think a lot of times I ask patients, well, what are you doing for strengthen your core? And they just say, oh, I do about 100 sit-ups a day, and that's it. And I'm like, that is not the answer. And oftentimes it might hurt. I think doing resistance band exercises, sometimes hip abductors that can engage the core, planks and different stretching exercises can be tremendously helpful. I tend to stay away from exercises um, such as sit-ups, which can just be repetitive motion, or bending at the waist, which can ultimately have a detrimental effect, as well as heavy kind of axial loading exercises such as squats that place a huge amount of weight on the shoulders and really compress those lower lumbar discs that can ultimately degenerate them quicker. So those are things that I typically try to avoid. And I think that doing more stretching exercises, resistance band exercises, planks, um, exercises of those nature are usually very beneficial. And I'm also a tremendous fan of low impact aerobic exercises such as pool walking and water aerobic exercises that can be really engage that core and be tremendously helpful than something that has more high impact like running, where you're kind of hitting on a hard pavement repetitively that can ultimately, have some negative impact on that lumbar spine.
I'm glad you said that because you open bodies up for a living. You see the damage that is done by gravity alone. And then you see what we do to ourselves in a regular day. Obviously, the sitting is not ideal for all of us, even though Dr. Conte and I are damaging our bodies for you right now as we listen to this podcast. But I do think that movement is one of the critical components, but it has to be movement done with intention. It's
Mhm.
someone who can be really helpful. And you're right, hearing someone contemplating 100 sit-ups as core strengthening is one of those moments where we have to reflect what happened in 1980 and what happens in the year 2025 and 2026. So well done on that part. As you moved into the ability to visualize the spine and some of the things that we do that are real lifestyle modifications in a degenerative way, um, do you have you seen kind of a common theme for spinal surgery as it relates to disc? Is it more overweight, or is it more their activities of daily living or lack thereof, or is it really you're seeing more of kind of like a common theme would be it's a combination of everything. It's poor strengthening and whatnot.
I would say it's a combination of everything. I'm sure, you know, in patients with obesity and who are significantly overweight, that does play into account with it as well too. Smoking is obviously something as well too that patients don't realize it, but does have a significant impact on spine health and does can accelerate degenerative disc disease as well too. Patients with osteoporosis or poor bone health oftentimes will have accelerated degenerative disc disease from their underlying conditions. And then, of course, patients that lack that core strength or have practiced poor spine ergonomics. So I think that I'm just listing each and every separate factor that might contribute, but a lot of my patients have two, three, four, all these factors combined that when you put them together, it's pretty clear why they have, why they're presenting with spine problems.
You're right. The high red flags that make us stop and think. One of them, and many don't talk about this, because they use the word smoking, and I will tell you, ironically, having spoke to Gen Zs, they don't see smoking the same when they're vaping. They don't see it the
Yeah.
same.
Yeah.
Can you comment on that?
Absolutely. Yeah. I ask my patients, each and every one and especially those who are considering undergoing a spine surgery, because smoking nicotine will often inhibit a successful fusion surgery. And when I asked them, I was like, well, are you smoking right now? I was like, no. I was like, well, are you using nicotine products? I just vape occasionally. And I think it's seeing in the mind that is not considered smoking, but in fact, that's just as detrimental as smoking. And something that, the more you're using these nicotine products, the more it can inhibit really just the spine's, the vasculature surrounding the spine and the spine's ability to just obtain, its vital blood supply in order to maintain its health. And when you compromise that, you're really compromising the overall health of your spine. And I think that patients are like, well, I've stopped smoking. I'm fine. But they don't realize that things like vaping or other forms of nicotine use can be just as detrimental.
I'm glad you said that, because those that are listening right now, our large audience is actually our Gen Zs and our millennials. And I've had this conversation previously, but now they can take it from a neurosurgeon, someone who really does work in the brain and actually can tell you that unfortunately nicotine does have a deleterious impact on our health, and we need to get that checked, whether it's sticking the Z-Packs in your gums, which is often a very interesting thing just for me to think about, because I can barely chew gum and walk, let alone stick a pack of nicotine in there. But I think it's really important as people start to reflect on the number of things that layer on to make an unfortunate event happen. And we don't count on it happening. But when it does, you can look back and say, all right, I set myself up for failure. And the outcomes are going to be having to see the people that you don't want to see. We love Dr. Conte, but you don't want to see Dr. Conte. So do your best and take that Z-Pack out of your mouth. It has been phenomenal to talk to you, because I know a lot of people do have questions, but they're afraid to ask. So having someone like you really is, it's proactive for them to understand that this is a important reality. Your job is critical, and that conservative care is always one of those places where doctors have to communicate effectively together to ensure that the patient is centered with choices and opportunities. I'd like to ask you in closing if listeners could actually do one small thing today that could improve their health. We brought up a lot of red flags, but let's say one thing that they could do today, because my audience loves homework. What would that be that you would recommend for them?
It would have to be preventative measures, strengthening your core and practicing good spine ergonomics. I'm sitting right now on a chair with lumbar support and armrests, which is essentially forcing me to stand in a nice neutral upright posture, in a nice neutral alignment. I engage my core with different exercises every day in order to prevent ultimately when I'm 60, 70, 80 years old, from having a severely degenerated spine. And we don't realize that, day in, one day, 2 days of doing it, it's sure, maybe it doesn't make a difference, but you combine all those days of these just very small changes and you can have a lifetime of benefit from them.
You're absolutely right. And I love that you put it together like that because, you could go for a walk and meet someone on the street who is severely stooped over. That did not take a day to happen. That took many years, and it's very difficult to undo some of these changes that happen when we're consistently not aware or not performing at our best when we know what's best. So I thank you, Dr. Conte, because when they know better, they can choose to do better. And that is the theme of Adjusted Reality. And a very sincere thank you for joining us today and helping our audience really understand and prevent what is preventable. And when they need a neurosurgeon, I hope they have someone as talented and wise and experienced as you. So thank you so much for joining us on Adjusted Reality today.
Well, thank you, Sherry. It was great being here, and I appreciate you having me.
Well, I want to thank you for joining us in Adjusted Reality as we spoke to Dr. Anthony Conte about the importance of spinal health. Yes, he said it. He is the last person that people want to see, but I'll tell you what, if you do have to have surgery, please do listen to this, or if it's a loved one that's going to have surgery, listen to this Adjusted Reality episode, because this is the episode where you can think about what are the things involved if there is a surgical intervention that's necessary. And also the beauty of collaboration. What does that look like when a chiropractor and a neurosurgeon work beautifully together? It means the patient's going to get what they need when they need it. And that, I think, is one of the critical components to a successful outcome. And it also is an adjusted reality that we can prevent much of which happens to our bodies. And we want to really protect it for longevity. So being proactive with your healthcare rather than reactive, I think is going to be one of the places that 2026 is going to take us. So I want to thank you for joining us during this podcast. We know life moves pretty fast, and we want to make sure you never miss an episode. So you can visit f4cp.org/adjusted reality to subscribe to our newsletter. Now, while you're there, you can pick up your copy of Adjusted Reality, or you can give it to a loved one, someone who needs more, an inspiration, a motivation, some passion back in their lives, advocacy for themselves. That's where you can pick it up. It's at Barnes & Nobles and Amazon. We've hit the charts, #1 in many categories on Amazon as well as Barnes & Nobles. So it's a book that they can rely on to really help them be better and supercharge their whole being. Now, if you're interested in hearing from a specific guest, you can also send us your guest recommendations. Yes, we know you're out there, and we thank you for listening. And if you can't get enough of Adjusted Reality, I'm excited to share that oftentimes when life gets challenging, well, there's past episodes that you can listen to. So remind yourself to subscribe and share this podcast with your family and friends, because the more they know, the better they can do. But please rate and review. We know how much time it takes to listen to a podcast. So why not rate and review? I hope you're enjoying it. I see the numbers and I'm grateful to you. And if you're also inspired to learn more about chiropractic, maybe this is the year you get your first chiropractic checkup. Well, you can go to the Find a Doctor directory somewhere close to home. Make it easy on yourself. That's f4cp.org/find a doctor. Maybe you're finding one for the aunt or the uncle or the best friend. Well, you can find it right there. We appreciate your support, and as always, we look forward to checking in with you again soon.